First, let me introduce myself. I'm Neil Richmond. I'm the Director of Programs and Advocacy with BreatheLA, and I'll be the moderator here today. BreatheLA is an independent, nonprofit organization addressing the lung health needs of Los Angeles County. We're here to promote clean air and healthy lungs through research, education, advocacy, and technology. You'll hear a lot more about our programs today from Claudia Medina, who will be one of the speakers. We have a century of accomplishments. We're one of the oldest nonprofit organizations here in Southern California. We originated to address the problem of tuberculosis, because believe it or not, the air was so clear once in LA County that people came here for recuperation and to improve their health. And then, of course, air quality has declined, but we've been very involved with advocacy, and we are making important strides in improving air quality throughout the region. And we continue, even though the tuberculosis crisis problem is still with us, we are also branched off and working on a number of other lung health-related issues like asthma and COPD. I'd like to introduce our first speaker, Enrique Chiak. He's the President and CEO of BreatheLA, and he'll provide the formal welcome and issue the charge before us today. We're all going to get charged up when we hear this charge. So Enrique, if you could welcome everyone.
Well, good morning, ladies and gentlemen. I just wanted to thank you for joining us this morning, and on behalf of the Board of Directors and those whose lives are affected by COPD, to welcome you to the culminating or concluding event of the first Los Angeles Summit on COPD. We extend our warm welcome to our partner from Northern California and from the beautiful Hawaii, and as well to our guests from the East Coast who are joining us via our webinar. Welcome. Thank you. I appreciate your being here today. At any rate, as we already know, COPD is the leading killer of Americans. Despite minimal progress that has been made in treatment of COPD, there's still a long road ahead of us. Last year, the U.S. Senate reported that treating those with COPD cost approximately $50 billion, that 50 with a B, $50 billion per year. And there are still millions of Americans with symptoms of COPD who have not been diagnosed. Misperceptions about symptoms and causes of COPD still exist. And most importantly, there's still no cure in the horizon for this debilitating and fatal disease, which means all of us still have work to do. To this end, today, we will receive a lot of information from leaders in the COPD movement, some of them with many years of experience. Later in the day, we will ask your feedback to help us articulate a basic action plan to bring sufficient attention and resources to make the prevention, early detection, and treatment of COPD a national public health priority. We look forward to working with you together in this very important charge. Thank you, and welcome.
I want to thank the National Heart, Blood, and Lung Institute, or the National Institute of Health, for being the primary sponsor of this event. We are honored to have been designated by this federal agency as the Western Region Center for COPD, and our activities over this past year have been guided by their vision. We appreciate so much the technical assistance and support that they've provided. And I want to thank the following organizations who contribute to our COPD education efforts: AstraZeneca, Boehringer Ingelheim, GlaxoSmithKline, Pfizer, and the LA County Supervisor, Zevi Arslavsky. We have a number of people here from pharma today. Can you raise your hands? So yeah, well, that's great. And so make sure you touch base with them and thank them for their support of COPD work. Next, I want to thank our outstanding group of speakers who have volunteered their time today to share their experience as being leaders on COPD. And each instance, a personal story, has motivated them as they took charge, brought attention and resources and necessary services to address the COPD crisis. The speakers today bring together an amazingly diverse background and are from various parts of the Western region as well as DC. But we hear repeating themes today of how gaining knowledge has led to effective action. And I want to thank each of you in the audience for taking time out of your day to help us build a movement to make COPD a public priority. So I said COPD crisis. What do I mean by this term COPD crisis? And some of these points I'm just going to reiterate that Enrique made. But as you now know, COPD is the third leading cause of death in the nation. And I should add that very often people die of COPD, but they're actually categorized as heart disease, and it may be even higher than that. We really clearly don't know. The National Heart and Blood Institute estimates that 12 million people have been diagnosed with COPD, but there's another 12 million who haven't been diagnosed. So only 1 out of 2 are really getting the attention and services that they need potentially. 2.7 million residents here in California, the highest number of any state in the nation. And we're going to have Guy Suhu talk about the changing face of COPD, but COPD kills more women than men now, and that of course reflects in part changing in traditions around smoking practices that occurred around the mid-century, and that's now being reflected in the rates of COPD we see today. A person with COPD dies every 4 minutes in the US. It's estimated that worldwide 600 million people have COPD, and that comes not just from tobacco smoking, but from ways people cook and ways that they heat their homes, and it's still an enormous global crisis as well as a national crisis. And the frustrating part is that it's relatively easy to diagnose using spirometry, where a patient just exhales into a tube, and it should be something that we see routinely in doctor's office, but it's just really kind of shocking that it's not a primary diagnostic. We've been finding that people with COPD, they're being diagnosed without spirometry, when spirometry is a critical element of the diagnosis process. It's non-invasive, it's underutilized. Only a third or less of the people with COPD have ever undergone the test. This conference is the final step of a multi-step process. At our kickoff summit in Los Angeles, we learned from the breakout sessions that many people wanted to dedicate themselves to addressing the COPD crisis. Moreover, those sessions brought out many useful ideas, and especially the need to focus on advocacy, and therefore that is the theme today. There have been very successful conferences in Hawaii, in the Bay Area, in Los Angeles, and today we're going to benefit from experiences of our colleagues from across our region as they share their stories of empowerment, program delivery, and advocacy.